Hey guys, welcome back to Medical Coding with Blue on Patreon. Okay, so this is the next installment of the Meet the Modifier. Today's modifier, Meet Modifier 24. So, I'm going to be reading from the NOVITAS website because, I love my NOVITAS. And I'm going to be reading from another website for physician's practice. And I'm going to be leaving both links in the description box below. These are very good and reliable links that will give you very good and solid advice about this. Now, especially from NOVITAS, because NOVITAS is where it's at. Now, Modifier 24, let us begin. I'm going to read from NOVITAS first. This is a fact sheet about Modifier 24. What you need to know. Modifier 24 is defined as an unrelated evaluation and management service by the same physician or other qualified healthcare professional during the postoperative period. Medicare defines the same physician as physicians in the same group practice who are in the same specialty. So that's why this can apply to like the PA, like if the surgeon sees them first and then the PA in the same group sees them for like the post follow-up. You can do that. You can put the 24 modifier on the evaluation and management for the PA, just saying. In this instance, they must bill and be paid as though they were a single physician. Modifier 24 is applied to two code sets. E&M, Evaluation and Management Services, 99201 to 99499, right? And then General Ophthalmological Services, 92002 to 92014, which are eye examination codes. Okay, and I would just want to point out this is probably not updated because it says 99201, and that's not what our providers use anymore. It starts with 99202. Just saying. All right, and then appropriate use. Use Modifier 24 with the appropriate level of E&M service. Use Modifier 24 on an E&M when an unrelated evaluation and management service is performed beginning the day after the procedure by the same physician during the 10 or 90-day global period, postoperative global period. Documentation indicates that the service was exclusively for treatment of the underlying condition and not for the postoperative care. The same physician is managing immunosuppressant therapy during the postoperative period of a transplant. Okay, that's when you can also use it. The same physician is managing chemotherapy during the postoperative period of a procedure. Unrelated critical care performed by the same physician during the postoperative period. The same diagnosis as the original procedure could be used for the new E&M if the problem occurs at a different anatomical site. So, just something to keep in mind, all right? Inappropriate use. Do not use Modifier 24 when the E&M service is for a surgical complication or an infection, because that is included in the global package. Okay, just like the normal routine ones, they're included in there, and there's no separate evaluation and management code for that. Just saying. This treatment is part of the surgical package. That's what it says right here. So the next one is the service is removal of sutures or other wound treatment. This treatment is part of the surgery package. That's true. Dressing changes and suture removals, that's all part of the global package. The surgeon admits a patient to a skilled nursing facility for a condition related to the surgery. That is when you do not use Modifier 24. The medical record documentation clearly indicates that the E&M is related to the surgery, which why would you even put a modifier on that? Why would you even have an evaluation and management? Outside of the postoperative period of a procedure. Obviously, if a patient is outside of the postoperative period, this Modifier 24 does not even apply anymore, okay? The services are rendered on the same day as the procedure. Reporting exams performed for routine postoperative care. Reporting surgical procedures, labs, x-rays, or supply codes. Okay, again, an example of when not to use Modifier 24. So on physician's practice, which I love, using Modifier 24, understanding the rules of the game. This is by Betsy Nicoletti. Oh my God, it's Betsy! I always want to say that. So, reviewing the definitions of modifiers, first, will ensure that applying a modifier goes from a game of chance to a sure thing. Appending modifiers on a claim form is like playing Monopoly. Use the right modifier in the right situation, and it's like passing go and collecting $200. The claim sails through the claims processing system on the first pass, and the insurance company deposits money into the practice's account. However, use modifiers incorrectly, and you will receive payment denials or worse. Not unlike picking a go-to-jail card, incorrect modifier usage puts your practice at risk for a payer request for a refund, which is never a good thing. Modifier 24 is appended to an evaluation and management service, never to a procedure, to indicate that an unrelated evaluation and management service was provided by the same physician during the postoperative period. Other same specialty physicians are included in the definition of same physician. That is, if a surgeon is covering post-operative patients for her partner, then the covering surgeon is considered the same physician and does not bill for it. Remember, modifier 24 is used for an unrelated evaluation and management service. The following are 3 examples where you could use modifier 24, and this is why I like physician's practice. Okay, so here we go. A physician performs a hernia repair on May 20th. The procedure has a 90-day global period, so all related postoperative care is included in the payment for the hernia. But on January the 1st, which is about a little over a month afterwards, right, the patient returns to have a breast lump evaluated. Report the evaluation and management service with the modifier 24 attached and the new diagnosis, breast lump, as the reason for the visit. That's the first example. Second example, an orthopedist treats a hip fracture on December 15th. The patient returns with shoulder pain on January the 10th. The January 10th visit is separately reportable with a modifier 24. Okay? A surgeon who is managing immunosuppressive therapy during the postoperative period for a transplant may also use modifier 24 on the evaluation and management services and be paid separately for these, because immunosuppressive therapy is completely separate. Even though you would think it would be part of that, it's completely separate. Okay. The Medicare and CPT definition of postoperative global package are slightly different. Medicare states that unless a return trip to the operating room is required, all medical and surgical post-op complications are included in the global payment and may not be separately billed. Okay. Also, treatment of wound infections or other complications may not be reported to Medicare. However, the CPT definition of the surgical package is typical post-operative care. This is found in the introductory material to the surgical section in the CPT book. This raises the question: if a payer follows CPT rules and not Medicare rules, can a surgeon report a atypical post-op care for complications? Yes. How? Some practices use modifier 24 in this instance for E&M services for medical complications. Use the complication diagnoses code first on the claim form. However, it is critical that you check with your payer to be sure that it follows its rules, because the definition of modifier 24 is developed by the AMA is for unrelated care. So you have to be very, very careful when it comes to deviating from what like Medicare says. Most insurances will follow Medicare rules. So that is why a lot of them, like if you have a question, if you look on the CMS website, you can pretty much find your answer there, because a lot of insurance companies follow their lead. Again, some may not. So you have to really dig in to your payers' different rules, because sometimes if you're looking and then you see that they do offer payment for something that is like what they're saying, like the post-op complications and things like that, then maybe you can, but check to make sure, because typically it's saying right? That it is part of the global package. Because before it was like, oh yeah, if they have like a complication or things like that, you know, that's separate. You know, separately identifiable E&M service, and yeah, you could report it. Until they changed it. So that is why now it's just like, okay, if they have an infection or something like that, you know, that's part of the global package. You know, it's considered like part of the routine care, that it's expected that sometimes there's going to be an infection or, you know, something like that. So that's just something to think about. All right. Other physicians who see the patient during the global period do not need to use modifier 24. If a patient in a surgical post-op period sees an internist, the internist does need to append a modifier to the E&M service. Only the operating physician and his or her same specialty partners or covering physicians need to use modifier 24. Let me read that again. Other physicians who see the patient during the global period do not need to use modifier 24. If a patient in a surgical post-op sees an internist, the internist does need to append a modifier to an E&M service. Only the operating physician and his or her same specialty partners or covering surgeons need to use modifier 24. So this is to say, like, if the patient is in ortho post-op, right? And then they go and they see ophthalmology. Ophthalmology does not have to put a 24 modifier on their E&M service because they are a completely separate service. It is only the providers that are in ortho that need to add that 24 modifier to that E&M service if there's something separately identifiable happening in the post-operative period. I hope that made sense. And then it says, review the official definition of each modifier in the CPT book annually. It provides the definitive answers to your questions so that applying a modifier goes from a game of chance to a sure thing. I really like the way she wrote this one. This is pretty good. So again, I'm going to keep this video short because I want these to be in little snack size, bite-sized pieces. And I will be back later on for another video. So I will see y'all again soon. And if you have a special request, let me know. And leave it in the comments below and I will get on it. All right, I will see y'all in the next video. Bye.